joint every they classify them based on the line for the actual fraction. Textbook, I think they have a fracture, page 226. 3 or more little pieces of bone fragments, okay, that can actually protrude through the skin. A comminuted fracture, of course, with that one you have to be very careful because the skin is broken and you're more prone to getting what? Infections from it, okay? Also, they have in your textbook a displaced and a non-displaced fracture. Look at the displaced fracture. In children during bone. There are common to this that's not listed in your textbook because they're different. There are a lot of them. Colles fracture, Colles, C-O-L-L-E-S. A Colles fracture, of course, when you fall and you're breaking a fall, typically you're going to fracture the distal end of the radius and what? The ulna, okay? That's a Colles fracture, which is pretty common when you fall. Epiphyseal fracture. Epiphyseal fracture, of course, is common in children as well. That's where the fracture occurs in the epiphysis. And, of course, if the bone has not completely developed, there's going to be, and if it's not treated properly, you're going to have some abnormalities with that particular what? Bone. Because we know the growth or the growth zone is in what part? That completely grown, or if you don't have that line left behind, and if you don't get it treated immediately, you have a one long leg and one short leg. All right. There are different means of treating it. So they have comminuted, green stick. Yeah, I thought they had more in the older edition. I don't know. But anyway, know the difference between a stress fracture and a pathological fracture. Here are the ones right here that I just mentioned to you. The healing of fractures, of course, you need to read over those steps. The first thing that's going to form is a hematoma, which is really a blood clot. Okay, a blood clot is going to form, and look how swollen. Look how this bone has been completely. This looks like a comminuted fracture because you can see the little bone pieces right here. The bone has been completely torn into what? Half. So you're going to have a hematoma, which is the first thing that's going to form, which is a large what? Blood clot. And then you have the soft callus, okay, because you're going to have to come in and start laying down new bone, new collagen, the hydroxyapatite. As you can see, new blood vessels are actually what? Forming. Granulation tissue, of course, is just really tissue. Those of you that have probably had one, granulation tissue is usually pink or red in color, okay? It's really soft to the touch, kind of has pulse in it, soft and squishy. There's actually new connective tissue that's actually being laid down, which is what granulation tissue is. So first thing you're going to have, feeling pretty good, right? Now the spongy bone has actually been what? Laid took for the healing process to occur. Sometimes it takes a little bit longer. It just depends on the type of fracture that you have, and it also depends on which bone has actually been what? Fractured. Make sure you read that. Did any of you have surgery? Did any of you have like plates, screws? Fold reduction, of course, is the most common type of surgery. That's when the bone kind of, you really don't do a lot to it. You just kind of put it back in place. You put a cast and a splint on it, you know. Procedure in which the bone fragments are manipulated into their normal positions without what? Surgery. Here you have to have surgery. So do any of you have plates and screws and nails and all of that inside of you? No plates or screws. So you guys didn't have to have what? The open reduction. Surgical exposure of the bone and the use of plates depends on the severity. Again, depends to what? To realign what? The fragments. All right. So on page 227 of your textbook, they're actually showing you an open reduction of an ankle fracture, where you can see the screws. This fracture has been set by surgically exposing the bones and realigning the fragments with what? Plates and what? Screws. The thing about open reduction, make sure you find a really good doctor that can do it, because from my understanding, some people that have those plates and screws, if they're not in place properly, could be still be a lot of pain. You can experience a lot of pain with those plates and screws if the doctor has not done it properly. Traction, of course, elevated, and there was like, looks like a rope attached to it. Has anybody seen that? And it, yeah, and that's really to keep pressure and to keep them from moving, kind of stabilize that area while the bone is actually what? Healing. Long-term to bed, they don't do it typically on the elderly people, because ambulation, you pre-nursing majors, that's a term you're going to have to know, ambulation, because they don't use traction with elderly people because they want to get them up and walking sooner, so they won't have them in that elevated position very long. have E-stim, where did anybody get any electrical stimulation? Where they put the little pads or the probes on you to kind of stimulate that area. The most common bone disease, severe loss of what? Yeah, the thickness of what? The bone, right? The bone is very what? Dense. You know, like they say in African American, we have big bones, thick bones, big bones, all right? Osteoporosis is not as common. Column. What bone is this? Huh? Femur. Where's the neck of the femur? Right here. Well, this bone doesn't have an anatomical and a surgical neck, only the humerus. Where's the greater trochanter? Carissa Cobb. What's your name? Curtissa? Curtissa? Yeah, Carissa, Curtissa. Where's the greater trochanter? I hope you knew it by Tuesday. The what? Scott? This part right here. Where's the lesser trochanter? This little bump right here. When do these two parts form? Mandisa? I really should have put more structures out there for you guys, because when we start talking about muscles, a lot of these parts that you guys have got to learn, tendons attach here, all right? Tendons, ligaments, things of that sort. So that's why you need to know, you really need to know what these are too, because these are condyles. I don't know if did I put epicondyles for this bone? Yeah, you have your epicondyles, which are here, and you have your condyles, which are where? Here, these little soft, wet knobs here. Look like little knobs. So, hip fractures, most common places would be here in the neck, and also between the greater and the lesser trochanter. Okay? What are some other causes that could lead to osteoporosis? Well, we know age. So as we get up in age, what happens? What causes osteoporosis? Ladies? Right, the osteoclasts start to what? Outpace what the osteoblasts, because typically there's a balance between the two. What are osteoclasts? What are osteoblasts? Yeah, you. Mm-mm. What are osteoblasts? Mr. Hill, what are osteoblasts? Right. Bone forming what? Cells, right? Now what are osteoclasts? Right. Bone dissolving what? It's gonna be on your next test next. Okay. Menopause. Cirrhosis. Green leafy vegetables, consuming your milk, your yogurt, things of that sort, of course, is what? Preventing this. Things that can lead to osteoporosis or put you at risk for it. Men get it too, but it's more common in women than in men. Smoking. If you are a smoker, you're at risk for what? Getting osteoporosis. If you have diabetes, you're at risk for what? Getting osteoporosis. If you drink excessively, alcohol consumption puts you at risk of having what? Osteoporosis. A poor diet. Eating at McDonald's every day. Eating at those barbecue joints every day. Got enough of them out there, which people are going to be doing a lot of this weekend. That stuff causes cancer, but anyway, that's another story. Huh? You mean testosterone in men? Remember, estrogen has a stronger effect. Estrogen, of course, is more, and then men, they're secreting testosterone forever. They don't ever stop secreting it, you know. Um, they secrete it until they die. But women, on the other hand, of course, we get the bad end, always a raw deal for us, you know. So yeah, as we start aging, the estrogen level starts dropping. Also, athletes, girls that are athletes that don't have periods, they're more at risk of what? They don't have any body fat. A lot of them don't have enough body fat on them So I guess a good thing, if you're a little bit thick on the heavy side, that could be a plus, you know. But typically athletes, females, estrogen is what causes you to ovulate and have your what? Your period every month, or your menstrual cycle. A lot of times athletes, girls that have zero body fat percentage, nothing but muscle, sometimes they don't have what? Cycles. And of course they're at risk for what? Osteoporosis as well. Fosamax, of course, I'm sure you guys have probably heard about that drugs, right? Okay. What do y'all know about Fosamax? Because that's been in the news a lot over the past year. Remember, they were giving that drugs to people with osteoporosis, and there were a lot of complaints about it because people were saying that they were still having fractures, even while they were taking that particular drug. So now doctors are saying that if you take it, you should be on it for a short period of time and then get off, you know, for an X number of years and then get back on it. So why not just prevent it? So you can see, like I said, the spine becomes compressed, deteriorating, which leads to what? The widow's hump, that little hump that you see in her shoulders. On page 227, they have disorders described elsewhere. Kyphosis, which is one of those disorders, which is on page 252. So as we're going through the next 3 chapters, we're going to hit on all of those. Kyphosis, of course, is another name, is the anatomical name for the widow's hump that you see, which is abnormal curvature of what? The shoulders. Okay. Osteoporosis occurs in both sexes and all ages, from adolescence to what? Old age. Okay. Postmenopausal white women, however, are at the greatest risk. In contrast to men and black women, less what? Bone. White women begin losing it earlier, as young as age 35, and they lose it more what? Rapidly. By age 70, the average white woman loses 30% of her bone tissue. Until menopause, estrogen maintains what? Bone density by inhibiting. And your osteoclast activity begins to outpace what? Bone deposition by what? Black women, on the other hand, also lose bone density after menopause, but having denser bones to begin with, they usually do not lose enough to suffer what? Osteoporosis. About 20% of osteoporosis patients are what? Men. For most, the testes and adrenal glands secrete enough estrogen, even in old age, to maintain. Some other risk factors include what? Smoking, diabetes mellitus, poor diet, and bearing. You got it? So, exercise, weight-bearing exercise is very, very what? Important. Any questions about that? That's the end of this chapter.